Hello everyone, my name is Dr. Tanja Radenko-Medenica and greetings from Belgrade. Today's patient is Svetlana. Objectively, she has brow and upper eyelid ptosis. She complains about skin laxity and overall tired look. Objectively, she also has ptosis and on the lower third of the face and skin elastosis and wrinkling in submental area. Okay, after the proper marking the patient, and of course we have to check the position of the eyebrow, the position of the middle and the lower face, the quality of the skin and the sagging of the skin. And to check again what we will do with this patient and what threads we will use. So in this patient, for the submental area, we'll use Nano Excellence. For the lower face, we'll use light leaf thread. And for the upper face, we'll use light leaf needle. Okay, and to check the right vectors for the proper situation and for the proper threads. Now we will mark the patient. Marking is very important because it is, let's say, half of the whole job that we should do. When we do light lift needle, we should mark 2 triangles, or in some other cases we can draw 3 triangles to lift the eyebrow and the lateral part of the eye. If the ptosis is much severe, then in this case then we can do 3, even 4 or 5 triangles or loops. For this patient we'll do just 2 because she wants to be natural and to do a small elevation of the eyebrow and the lateral tip of the eyebrow and the lateral canthus. When we look at the lower face, she complains about sagging look and this small fat pad in the prejaw sulcus. We mark the entry point, and the entry point is just in front of the tragus, and then we mark the whole vector of the thread. We will also lift the marionette lines and the prejaw sulcus. In the submental area, we see the skin laxity and small fat pad, which our patient doesn't like, so we can lift it and we can improve skin quality with these threads. Every procedure we start with local anesthesia. First we inject the anesthesia into the entry points, and then we take cannula and infiltrate all vectors and the whole face, because in this case we are going to do the whole face. Local anesthesia is very good, not just to eliminate the pain, but to do a small hydrodissection, and it enables easier penetration through skin layers, but we have to be very careful because if we put a large amount of anesthesia, the threads won't get in the right position because they will fluctuate through the skin. So be very careful with putting the local anesthesia, and the amount should be very small. And now we are starting the procedure with light lift needle for the lifting the eyebrow and the lateral part of the eye. Okay, we use needle blunt with 50 centimeter thread connected to the blunt cannulas. We are placing the entry point about 5 centimeters above the brow. If we need more lateral lifting, the entry point will be more lateral of the temporal crest, and if we need more medial lifting, it will be more medial to the temporal crest. We are making 2 triangles, as I said before, or 2 loops, and even in some cases you can do more. And we repeat everything the same on the other side.